we'll record it in speaker view instead of Brady Bunch view, and we will make that recording available to anyone who might have a recording issue. So please bear with us for just a moment or two as Katie goes through and make sure that all of you have an opportunity to record. And then once we get the green light from her, I will give everybody an opportunity to speak up and say something if they, for whatever reason, don't have recording privileges.
Everyone
thank you
have
for
permission to record now.
All right, that's terrific. Thank you, Katie. I very much appreciate it. Yeah, and now is a good opportunity. If there's anyone out there who is having recording issues, you can speak up now and let me know. Rick, I see your microphone is off, so Rick is raising his hand. Might need recording.
I need recording. Oh,
okay,
now I'm recording. Now I'm recording.
Okay, good deal. But that's the way to do it. Rick just gave us good examples.
Actually, mine isn't recording. It says you're recording, but I'm not recording. I have to ask for permission.
Okay, you should have that now.
Give a glance to Brenda. Is she recording?
I'm good now.
Okay, good deal. But that's the way to do it. We want to make sure everyone has the opportunity to record. We also want to get rolling fairly soon. And if there are no other people with issues, we will move along here. So thanks, everyone. As you know, I'm Brooks Baehr. Glad to know that you guys all have the opportunity to join us quickly. A lot of questions about this. Certainly, a school has gone back into session. And as we have seen an escalation in case counts with the Omicron variant making its way through the islands. So we appreciate you taking the time to join us. And with us this morning, the two best people to talk about this topic are our state epidemiologist, Dr. Sarah Kemble, and the interim superintendent of schools, Keith Hayashi. They will both make opening remarks, and then they will take your questions. So after their opening remarks, if you have a question, please do raise your hand and we will call on you. And we'll take this right up at least to 10 o'clock or so. We hope to get through as many questions as we possibly can and explain this as best as we possibly can, because it does get confusing. So without further ado, Dr. Kemble, let's kick things off before we go to Superintendent Hayashi.
Good morning. The Hawaii Department of Health is releasing today interim COVID-19 guidance for isolation and quarantine in school settings. This update brings DOH guidance into close alignment with new CDC guidance for schools released on January 6th. The new guidance is available on DOCD's COVID-19 schools website as of this morning. The Department of Health recognizes the health benefits of children attending school in person, including the fundamental links between education and long-term health outcomes. The new guidance helps to minimize loss of learning days while continuing to prioritize safety on school campuses through multiple mitigation strategies. This new guidance allows for shortened isolation and quarantine duration in school settings. So for isolation, students and staff who test positive for COVID-19 or have COVID-19 symptoms should isolate for 5 days, regardless of their vaccination status. They can return to school when all of the following conditions are met. 5 full days have passed since symptoms first appeared or since their positive test was conducted, no fever for 24 hours, and they have no symptoms or symptoms have improved. For quarantine, students and staff who've been in close contact with a person with COVID-19 should quarantine for 5 days after their last contact. Quarantine applies to those who've not completed their primary vaccine series or 2 shots of Pfizer or Moderna, and those who are 18 or older and have completed their primary vaccine series but have not received a recommended booster when eligible. Students and staff should get tested on day 5 of quarantine, even if they don't have symptoms. One thing I'd like to point out is students and staff are not required to quarantine if they're age 5 to 17 and have completed their primary series, in other words, 2 shots of Pfizer or Moderna, or if they're 18 and older and have received all their recommended vaccine doses, including boosters. We are fortunate that in Hawaii, we've already set the expectation for correct and consistent use of well-fitting masks in all indoor settings and outdoor settings where crowding may occur. Our schools have been implementing universal masking since the start, which is a prerequisite to implementing this shortened isolation and quarantine. Schools will continue to implement layered mitigation strategies, including universal masking, promoting vaccines and boosters, cohorting, and other strategies to prevent COVID-19 transmission. There's abundant scientific evidence that layered mitigation strategies make schools one of the safest spaces for our KITță teachers to be. COVID-19 is less likely to be transmitted in schools than in most community settings. The Department of Health is continuously reviewing best practices and the latest scientific information. We've seen many twists and turns in this pandemic with new variants and changing transmission dynamics. We will continue to update guidance as the situation evolves. Thank you.
Thank you very much, Dr. Kemble. Now let's go to Superintendent Hayashi.
Good morning. The confidence that we have in being able to keep our schools open safely during this pandemic is in large part due to the close partnership, support, and guidance from the Department of Health. The new reduced isolation and quarantine guidance supports our efforts to continue to prioritize in-person learning while upholding safety protocols in our schools. The revisions also recognize the protection that vaccinations provide for our staff and students, and the added protection boosters provide for eligible staff. With the exception of our youngest learners under 5, everyone on our campuses is eligible to be vaccinated. I'm proud that more than 90% of our employees are vaccinated. We also continue to support efforts to make vaccinations accessible in our schools, along with COVID testing opportunities. This week, we began coordinating booster shots at schools. I want to thank all of our teachers, administrators, staff, parents, and students for doing their part in practicing the health measures that we have in place. Thank you.
Superintendent, thank you very much. So by now, I assume that you have all had an opportunity to see the press release we've sent. You've heard the opening remarks, and now let's go to questions and answer. And we'll start out by going to Nicole Tam at KITV. Nicole.
My question is for Superintendent Hayashi. Can you give an update on the absences of teachers this week as far as the number of teacher absent, and is there specific areas that have greater absences? Also want to know if there's any update on how to address the substitute shortage since the last time you gave that update.
Well, thank you, Nicole. We continue to monitor teacher absences statewide. Preliminary numbers are showing teacher absences are starting to decline slightly from last week's level. It's still about 12% though of our teacher workforce that's out. Approximately half are sick and half are out for other reasons that could include things like vacation, family leave, personal leave, and vacant positions. Where our school administrators and non-teaching staff are assisting along with complex area staff in helping to address the need for substitutes. Other teachers have been willing to help support and cover, and our state office staff are also standing by to assist. Thank you.
Okay, thank you, Keith. Now, Honolulu Star Advertiser, Esme Infante.
Hi, this question is for Dr. Kemble. I'm going to phrase this question in a way that I'm sure, parents across the state, and I'm a parent also, are thinking. I wanted to ask you if you could provide some data to back up the statement that you made earlier that there is evidence that spread of the virus is less in schools than in most community settings. And also, if you could also clarify why this guidance is considered, quote, interim.
Dr. Kemble, you are on mute. Thank you.
Excuse me, thank you. Yeah, thanks, Esme. There are many studies that have been done at the national level that have looked at school cases compared to community incidence rates. And what we see again and again is that cases in schools are either equivalent to or less than what we see in the community. We now know this locally too because of our school testing programs. Our percent positivity rates in our school testing programs have consistently been far lower than what we're seeing in the surrounding communities. While schools are certainly impacted by the Omicron variant, and this is a difficult time for all businesses and communal settings, it still shows that we have tools in place that can prevent transmission in school settings. And when you're doing layered mitigation, it makes a big difference. Oh, and I'm sorry, your other question about the interim guidance. We are currently, what we've issued today is specific to isolation and quarantine. We would like to go through and integrate this with the rest of our school guidance in the whole, because that also addresses the very important layered mitigation strategies. We don't anticipate major changes to mitigation strategies. Those are well known at this point, but we do want to make sure we've integrated this isolation and quarantine guidance with the other aspects of our school guidance. We plan to be meeting with our school partners in the coming week to look at that together and issue updated full recommendations for schools.
I see. Thank you. As a follow-up, and I don't want to hold up the press conference, but I am curious about the specific data where the school cases were looked at versus community rates. I know you talked about a national, but I also wondered if there's local numbers, but I don't want to hold up the news conference. I can follow up with Brooks afterwards. Thank you.
Thank you.
All right, let's move along to Civil Beat and Suevon.
Hi. Hello, thank you. I'm wondering, Superintendent Hayashi, how are schools intending to enforce the asymptomatic return of students after 5 days? Dr. Kemble had just mentioned that after 5 days, if they don't appear to have symptoms anymore or don't appear to be carrying the virus, then they can return. How do schools plan to enforce that? And real briefly, can Dr. Kemble also please address how the test to stay program might work as indicated in the guidance? Thank you.
Hi, Suevon. Thanks for the question. Schools will be monitoring students who are returning to school based on the attendance procedures that schools have in place on their respective campuses. Many times it is the either school administration or it's through the health room that those the cases are monitored. So that's the processes that schools use to monitor safe return for our students. Thank you.
And to take the question on test to stay has been discussed now in a lot of the national media. We've been hearing from other jurisdictions that have piloted test to stay programs, and it certainly looks promising for helping as another layer in mitigation for schools. So we are looking at we've heard from some schools that are interested in piloting test to stay programs. These are still in planning stages, so we're working on what needs to be in place for test to stay. Obviously, right now with very high testing demand, having the frequency of testing needed for a test to stay program can be challenging. So I think this is still an evolving situation, but we're looking at how the Department of Health can support those schools that would like to implement a test to stay strategy, and we're open to those discussions with those schools.
Thank you, Superintendent and Dr. Kemble. Let's go to Rick DAYSOG now with Hawaii News Now.
This is actually a follow-up to Nicole's question. The superintendent said the absentee rate was 12% for the staff for the teachers. What are the actual numbers, and what are the actual numbers for absenteeism for students?
Thank you, Rick, for the question. I'm sorry. So the first question was related to
the 12% you mentioned. Yeah. What's the actual number, and then what's the actual number for student absenteeism too?
I can get that actual number for you. I don't have it available to me right now, but I definitely can get that to you following this briefing. And your second question was related to students?
Absenteeism of students. How many students are out? You know, we're hearing different schools, the experiences are very different. There's a lot of people in some schools. Do you have any grasp of what the absentee numbers have been?
Right. So as far as the case counts in our schools, from December 1st to December 9th, which is end of last year, There was a daily average of about 81 cases were confirmed across about 42,000 staff and 160,000 students at our public schools statewide. Totaled about 1.6% across students and staff, including the recent increases after winter break. So we are definitely monitoring those numbers. Of course, that was prior to the break. While some schools are currently, though, we're closely monitoring student attendance. While some schools are seeing drops in student attendance, primarily preliminary data that we're taking a look at and we're monitoring shows most of our schools are actually holding steady, or in some cases actually seeing a boost in attendance this week compared to last week. By geographic region, about 9 of our 15 complexes, student attendance overall in the complex is up, which indicates that our schools are working definitely hard in trying to do everything they can to ensure that in-person learning is happening, and so that our students can remain in school to support our students and our communities. For the majority of the cases reported this week, the individuals were not on campus during the infectious period due to the winter break. And just to remind everyone too that one of our core mitigation strategies is to stay home if you're feeling sick. So even though we want our students in school, we also want to thank our students and our parents for doing their part in following through with the health measures that we have in place. Thank you.
As a quick follow-up, question, has there been any impact of the absenteeism of teachers? We're getting reports of students from multiple classrooms being taught at Kahuku High School, for example, in cafeterias because there are not enough teachers. Has there been those kind of impacts, and how are you dealing with it?
Right, due to the multiple teachers being out, without substitute teacher coverage, there's been some instances where students were being supervised in, say, the cafeteria or the gym, if there's no teacher available for any one of their periods. However, for the majority of the school day, most students are in classes and instruction is being provided. Non-teacher staff from the complex area have also been deployed to help with the coverage. And as I shared a little earlier, that our state office personnel also stand by to help. Schools definitely, credit to our teachers, our school administrators and staff for doing all they can to keep students in class. But if there are situations where things need to be adjusted, those are the limited times where those things might happen. Thank you.
Rick, thank you for the question. Superintendent, thank you for the answers. Let's go now to Jenn Boneza, and then we're going to go over to Melissa at the Maui News, and then we'll circle back to some of you who will be making who have second round questions. But right now, let's go to Jennifer Boneza with KHON 2.
Thanks, Brooks. This question, not quite sure who wants to answer this one, but how do you define close contacts in the classroom? And if you are considering the entire classroom close contacts, does that then mean that the unvaxxed children would have to quarantine if someone in the class was positive, and the vaccinated would not have to quarantine? And then second question is again regarding Rick's question about the cafeteria, Kahuku, anyone, when a teacher's absent, if kids are just being watched and being supervised, are they actually being taught when they're in the cafeteria? And what are you guys doing to ensure that they are being educated and not, just babysat while they're sitting in a room because there's no one to, no teacher there?
I can start by just speaking to the DOH definition of a close contact. In the school setting, that hasn't changed. That's for students, that's being within 3 feet of the positive individual for 15 minutes or more. And that's the definition of close contact in the classroom setting. For adults, it's still 6 feet of distance to be considered a close contact. And that's regardless of mask usage.
And when we do have students that have to be in the cafeteria and such. I think back as a former principal, and when there were situations where as an interim measure, we needed to have students perhaps in the cafeteria for a period of time to cover for a period if we didn't have coverage. In those situations, definitely, there's different strategies that schools utilize. For example, sustained silent reading, where we have students who are reading and studying for other tests that they have coming up or the content area. There's opportunity for that. If students have access and they have their computers, they can also connect in many situations with Google Classroom and be doing work online that other teachers have assigned or getting caught up. There's always an opportunity, I think, for students in any situation, no matter where they are, to be engaged in self-directed learning and reading, which we definitely encourage for all of our students. So yes, there are strategies that we have in place to ensure that students are actively engaged in some form of learning, which at the very least would be some sustained silent reading learning opportunities. Thank you.
All right, let's go over to Maui now. And Melissa, you've been patient. Thank you, Melissa.
No problem. Aloha, this is for Superintendent Hayashi. Superintendent, knowing that we have a smaller pool of substitutes here on the neighbor islands, Maui County, Molokai, and Lanai, can you tell me how Maui County is doing as far as filling staffing? That's one. And second question is, we heard of some bus routes being, temporarily suspended. I don't know if that's due to staff and COVID, but if you could comment about that.
Thank you, Melissa. Yes, for Maui County, like all of our other schools, our administrators, area superintendent, and their staffs are working very hard to ensure that we can cover the substitute needs at every school to the best of our ability. In this shortage that we have right now, so schools are working really hard, utilizing different strategies at their disposal. Regarding bus transportation, there has been a need, and we see this need nationwide, where busing is for us to find valid bus drivers with their CDL license. It is a struggle. And so our Office of Facilities and Operations have utilized different strategies, consolidating bus routes, offering different opportunities and incentives to parents and so forth. So while we recognize that it is a struggle, the department is very much committed to looking at alternative ways that we can help our students and our families with transportation. Thank you.
Thank you, Superintendent. Let's circle back around now for a second round of questions from some of our reporters. Let's go to Nicole at KITV, whose hand is still up. Nicole.
Thanks, Brooks. Yes, I have a follow-up to my original question for Superintendent Hayashi. So it's great that all these administrators from different schools are flexible, stepping in to help with teaching and watching kids. But do you anticipate student performance as far as test scores or just performance overall to be better than the last? And if you do think it's better, what kind of, theories or evidence do you have that support your opinion or your answer?
Yes, our schools are definitely doing all they can to help accelerate learning in these past years that we've been dealing with COVID-19. We do have various strategies that we're implementing in school. Definitely, first and foremost, we want to be sure that we're addressing health and safety. We're looking at accelerating learning and addressing the academic component, as well as looking at social emotional learning and those supports in place. While we do have strategies that we're implementing, we're very aware of the many challenges that schools face in this environment, and our schools are doing all they can to maintain that learning environment for our students as we move forward. Thank you.
Thank you, Superintendent. Now let's go back to the Honolulu Star Advertiser, Esme.
Hi there. Thank you so much. This question, I guess, would be for either Dr. Kemble or Superintendent. My question is, again, speaking from the point of view of parents and also some of the epidemiologists who have said that this is a terrible time to be reducing the time for quarantine and isolation. There are a number of experts who feel there's still a significant level of risk for a person to remain infectious beyond the 5 days. And I wonder how you would respond to parents who ask about that, especially given the record numbers of children who are being hospitalized with COVID-19. I think our nation is hitting a high right now. How do you respond to that?
I can take that first. As we've discussed this new guidance with CDC, we have many of the same questions. The evidence that CDC is citing, there is now, it's emerging, Omicron's very new, but as they're looking at what's emerging about Omicron, they did publish a science brief this week, which is available on their website. And it does go through a lot of the data and has many references. One of the things they're citing is that it looks like Omicron may have a shorter infectious period and a shorter incubation period. And so that's one of the things that's being very closely examined. And of course, we're still looking at new data every day. But I think that's part of the feeling that a shortened isolation and quarantine may be justified. I think we also have to acknowledge some of the practical realities that we have to balance trying to get the most infectious time period and the most high risk time to have people in isolation and quarantine, while recognizing the incredible disruption with the numbers of cases we're seeing with Omicron, to have that many kids out of school, not actively engaged in learning, or to have staffing issues. So I think, as we saw with many other businesses, and we're seeing continue even in our healthcare settings, there also are considerations for what is a practical balance between maximizing safety and enabling critical services to continue to function.
All right, and we're just about out of time, but if we can go to Civil Beat and Suevon, I know she's hanging on with the last question.
Thanks, Brooks. Dr. Kemble, what are we noticing about the severity of these cases coming out of the schools, both when it comes to kids and the adults? What kind of data is your department receiving, and what kind of information is the DOE sharing with you to indicate the level of severity of these cases compared with Delta from before? Thank you.
At this point, we aren't seeing signals within Hawaii for increased severity of illness. What we are seeing is a lot of cases. And with a lot of cases comes an increase in hospitalizations. We aren't seeing a clear signal in the data that cases that are getting hospitalized are more severe than what we were seeing before, or that cases who are infected are more likely to be hospitalized. In fact, I would say, because we were fortunate in Hawaii to already have very high vaccination coverage rates before Omicron hit, we are seeing in many ways less severe illness, especially among those who are vaccinated, who do become infected with the Omicron variant.
Brooks, can I get one quick question?
Okay, Rick, fire away. I'm going to try to be. Okay.
The part of the strategy for returning students from quarantine is testing. Does the DOE have tests available? How are the kids, how are they going to make it easier for the kids to get tested?
Hi, Rick. Thank you very much for the question. As far as for testing, we're focused on maintaining and expanding our school-based testing efforts in partnership with the Department of Health via federally funded programs. Operation Expanded Testing, or OET, and Epidemiology and Laboratory Capacity, or ELC, are testing opportunities for our students and our families. Additional rapid testing option is being provided by the Pacific Alliance Against COVID-19, or PAC, for schools in the Nanakuli, Waianae, Honoka'a, and Kohala complexes. As of December, 168 school-based testing sites were available in the HIDOE and at charter schools. ELC, which has been offered on the neighbor islands, expanded to Oahu last week with CVS, And I believe we've had so far 20 schools that have signed up in just this last week. We want to thank our partners for helping to keep our schools safe, and definitely always the Department of Health in being great partners together with us. Thank you, Rick.
All right, everybody. And I know there are a few of you that still have questions out there, but I know that our speakers today, Superintendent Hayashi and Dr. Kemble, have other engagements and scheduled things that they have to run off to. So I've got to respect their time. I appreciate you guys spending so much time with us this morning. Certainly our schools face the same kind of challenges that the broader communities face, and this new guidance will help those schools navigate through this pandemic. And as Dr. Kemble said early on, the guidance will continue to be updated based on best practices and the latest scientific evidence. So you can expect more updates to come as the pandemic continues to evolve. We will continue to look at the science and the best information available, and we'll hope to implement best practices. Again, thank you all very much for taking the time this morning. If anyone had a problem with their recording, we will of course make this available to you. Superintendent Hayashi and Dr. Kemble, thank you very much for taking the time this morning. And we will see everybody again very soon. Have a great day, everybody. And please mask up, get boosted if you're not boosted. And my goodness, if you feel any symptoms whatsoever, a sore throat, a tickly throat, or a runny nose, please stay away from others, isolate yourself from them until you can get tested and find out exactly what's going on. Let's flatten that curve together. Mahalo.
Thank you.